Where did you start your journey?
Father was a very powerful politician, like a kingmaker. So I failed whenever I want to fail. I passed whenever I want to pass.
Why didn't you get into politics?
Flaw I saw was, especially my younger brother Rajgopal Reddy and habit, their religion, their caste. That's the first thing I didn't like.
And why did you come back to India?
If a girl child was wearing glasses, the dowry either goes up or they won't accept her.
You're a great doctor.
Yeah.
Sometimes all doctors don't turn out to be great business to make it a spinning machine.
Yeah. I'm charging such high price. Am I available for the poorest of the poor? In reality, no.
This eradication of blindness, it's a very disturbing sign because this is something that can be prevented.
Why are there 250 people in one small village?
Welcome to Conversations on HYBIZTV. Usually we interview industrialists, we interview businessmen, women, we interview kind of IT leaders and everybody. But today we have somebody who's a doctor to start with. Not just an ordinary doctor, but somebody very special. Ladies and gentlemen, today I have with me somebody who has done human service in the field of eye healthcare. And I'm speaking of Kasu Prasad Reddy, the founder of Maxivision Eye Hospitals. He started his journey long back, and along this way, as we speak to him, we will try and understand where he began, where he is now, and where he wants to go. Welcome, sir. Namaste.
Namaste.
So, sir, tell me, doctor, where did you start your journey? I mean, where did you hail from originally? And can you tell us a bit about that part of the journey as to where you were born, your parents, your siblings, and all that?
Sir, actually, I was born in a small village called Bikkavolu, which is in East Godavari district. It's a beautiful village, like any other village in our country.
True.
And something that we all enjoy. So I enjoyed my first 6 to 7 years, if I can remember, of my life with my grandmother. Okay. We are about 6 of us, but when I was born, I had that wonderful blessing to be with the grandmother. So she was like a mother until I got to know my mom after 6, and then I was shifted back to Narsaraopet in Guntur district, which is my native place. That's where I hail from.
Okay.
But my parents are from that place.
Yeah. What about your parents? What was your dad doing? What was your mother?
My parents, my whole family is a pure political family.
Okay.
Okay. But politicians of that day, it's a little different,
Correct.
They were, we had a lot of lands, but they were selling the lands to be in politics. Yeah.
Continuous.
And it so happened, my father was a very powerful politician. He was like a kingmaker. And my uncle was, I don't know if you know, but he was the chief minister of the state for a long time.
Yes, sir.
And then later on, he went to center and became communication minister, then home minister of India with Srimati Gandhi. And then last stint he did was governor of Maharashtra. So then my elder brother took over. My younger brother also was in politics for some time with the elder brother. Whereas I left to England after my brother's first election. And then of late my elder brother's son also became an MLA. So it's all a continuous process, So
the most obvious question to ask you would be, why didn't you get into politics?
That's a very good question, sir. I was in politics. When I finished my medicine in Guntur Medical College, I got into, with my brother to see that he wins his first election, and I was campaigning and touching the feet of all the elderly villagers in every village. There were 65 villages. Begging them for the votes because my father was very sick on the bed and my brother won with thumping majority. But in that process, I didn't like certain things, which is, I come from Guntur Medical College, a certain forward caste and, backward scheduled caste. I have no caste, okay? every one of them are my friends because I was a sports person. You know, in sports, no such thing is there.
True.
It's pairship, friendship, we team and we play together. We never think of anything else. Whereas when I got into this 2-3 months of campaign, I realized everybody is talking against my friends, their religion, their caste. That's the first thing I didn't like. Then there was money. Okay. And obviously I thought I don't fit into this. At least let me. So I told my elder brother, listen, I'll stay with you till the election day. I'll do my best. After that, I'm leaving and I'm going to get into medicine, and that's what I did.
So you went on to do your MBBS from Guntur Medical College?
Yes, sir. No, I actually started my first year medicine Gulbarga Medical College.
Okay.
With Rajshekhar Reddy, who is my NCC commander, and KVP Ramchandra, who is one of my best friends. And we were together, and there was Pullai Chaudhary, who was my dearest friend. There was Raghav, all these guys. And then it so happened, I was so happy there. I was playing cricket, hockey, tennis, and I'm the best person for all the 3 sports for the college. And I didn't want to come back. By my parents at the time, there was late Sri Bollai Garu, who told him I can be transferred to Guntur, and I was brought back to Guntur because I was destined to meet all my friends in Guntur, who remain to be very good friends today, all in top positions in United States.
So from there, you didn't really specialize into ophthalmology, or you are not into eye care as such. You were a general physician.
Yes. You asked a beautiful question because I am a classical example for the youngsters who lose their way in the process of education. And then they can get back to the groove. Because in medical school, I was classed as the chief minister's son. People used to think, this guy doesn't need to study, he'll pass. And then I was a sports person. Nothing else interested me, books the least. Okay? So I failed whenever I want to fail, I passed whenever I want to pass. When I failed my anatomy, I gave a beautiful party. Because failure
teaches you a lot.
No, failure is the stepping stones to success is what they say. No. So I lived to that example. And then I told my friends, I can even celebrate a failure. So with that spirit, both in sports and life, I finished my MBBS in Guntur Medical College, then went to Chennai to do my MS General Surgery in Stanley Medical College. And after doing 3 years of MS General Surgery, I left to UK to do an FRCS in General Surgery. But then I was not getting a job. So the next nearest and the best thing was orthopedics. So I did 4 years of orthopedics and accident emergency. In England, if you do orthopedics, believe me, you become a fantastic trauma doctor. There's a lot of trauma there. And after that, I did have an issue with my boss, Mr. Price, and then I was kicked out of the department, and then I had some problems and then ended up in neurosurgery. So I did that for 1 year. So after neurosurgery, I did aviation medicine as well because I was interested in flying. Then I took a British, pilot license, a private pilot license, and I used to fly a lot. So in all this, when Dr. Miles Gibson, who was the president of Royal Colleges of Edinburgh, when I was working for him, he said, "Is something wrong with you? What's your CV? You don't have a stable mind.
You're jumping from one to another.
You just don't have stable mind." I said, "Listen, sir, when I wanted ophthalmology in Chennai, they gave me general surgery. When I came here for general surgery, they gave me orthopedics. When my boss blamed me unnecessarily, I resigned my job out of emotion. Then ended up with you in neurosurgery." He said, "Oh, the first thing you applied was ophthalmology. That was your primary specialty. So then came Dr. Kolli Lajpat Rai Chaudhary Garu, who hails from Krishna district. And he was having dinner in my house, and I told him all this, and he said, why don't you try ophthalmology? I'm an ophthalmic consultant. Be with me. I'll give you a job for a month as a locum. In England, locum means you take your holidays and you get paid here and there. Sounded good, I did it. Then both him and Dr. Srivastav Desai, so my gurus in ophthalmology, my teachers, are both Indians.
Okay.
And they taught me everything that they knew.
Even though you were abroad?
Yeah, even though I was abroad. They were the bosses. And then after 6 months, they called me and said, Dr. Reddy, what we learnt in 6 years, you learnt it in 6 months. I said, how did you do that? I said, I told my colleague and everybody to be off. I told my wife to excuse me for 6 months, and I worked every day 24/7, sir, because I'm too late to the specialty, which in medical terms I call it like an elderly primary to pregnancy.
Okay.
And I started running. So I learnt a lot in that first 6 months of my life, and I fell in love with the subject, and I never looked back. And I thought I should see the end of this specialty, and now that Miles Gibson put me straight, Dr. Kolli, Lajpat Rai Garu, and then also Srivastav Desai, they put me back in the groove.
So basically, you are making up for the lost time that you had.
I did. I worked damn hard to do that.
And why did you come back to India?
Now, I did a lot of, I learned everything from front to back of the eye, sir. I was a comprehensive ophthalmologist. That's how they train you in peripheral hospitals in England. So what happened, then I thought my two bosses taught me everything except laser treatment to remove glasses. So that was not in their domain. So I went to a professor called Professor Terry Ramsell and Professor Johri to learn techniques. The laser was being introduced for the first time in the world, and I was right time at the right place as the first Indian to be with him, and I learned excimer laser techniques to remove glasses. That was called PRK. That was the first thing in 1991. So 1991 February is when I started my life in my ambition to get rid of glasses for everybody who's over 19.
Okay.
So all my life I dedicated to devise techniques, to devise methods to remove glasses without any blemish to the patient, without any complications, side effects. So that was the dedication.
So that when you came back to India, and obviously the first thing you would have decided is to work for some hospital.
Exactly, yeah.
But you turned an entrepreneur.
Yes, sir. No, that was, see, everything, I'm a destiny's child. Nothing was decided by me.
Okay.
Like so far, what all story I told you is all destiny. And like you said, the real reason I came back, which was your previous question, I didn't answer that. I felt I served the white man long enough. I was there for 20 years, and the time has come for me to come and serve my own people, my own Indians. Because what happens when you come from a political family especially, you're constantly longing to come back to people, because we grew up in people. For us, everybody is inside my dad's bedroom. So irrespective of your caste, religion, region, whatever. So with that spirit, I thought I must come back, and I especially felt for our girl child. Because those days when I came back, if a girl child was wearing glasses, the dowry either goes up or they won't accept her. That I thought was very bad. And here I have a technology with which I can remove and get them married. That was the biggest ambition in me. Jokingly, maybe boys wear glasses, their dowry goes down. you know. But whatever it is, my ambition was that, to serve my own people, to come and serve my children in this country. So I always respected the female species of the world. And I thought, why not come and, serve? So that's why I came back. But again, coming back to what you just asked, and what was that?
Basically, why did you turn an entrepreneur?
Yeah. So what you just asked is, why did I turn into entrepreneur? Again, that was not this thing. It's the will of God and God's blessings. Actually, Apollo Hospital were very kind enough. They gave me a place to practice, and they asked me to put my laser there. I was there for a year. And then L.V. Prasad Eye Institute was like a temple in ophthalmology. So is Sarojini Devi in the government setup. So I'm surrounded by all the top-notch people. And I was and I am still a very small guy. So what happened, with that smallness in my mind, I thought, if I stayed in Apollo, for me, it will be wonderful. They will look after, I don't need to, be with the management, be concerned about the children who work for me, all that. And I can concentrate. But only flaw I saw was coming, my brother, especially my younger brother Rajgopal Reddy and my elder brother, they have this habit of saying, this man is from our hometown, okay? He's very close to our family, treat him free. Okay, so they don't understand. Even this interview costs money, you know that.
Correct, sir.
There's nothing that doesn't cost. But both my brothers don't have that. So they say, treat. So I have to entertain those people and treat them free.
And there's a cost attached to it.
Yeah, but they both taught me one thing, sir, which is, that is the day I realized nobody should touch my door and go back because they can't afford it. So what I decided, okay, let's devise a system where I can treat the poor absolutely free of cost, and so that they can afford it. And then I thought, how much intelligence do you need if a bus conductor comes with his daughter and says, I need to get her married, sir, and the glasses is a problem and I can't afford it. So sometimes your judgment can go wrong. Okay, the bus conductor may be a billionaire, I don't know. But I put this system in myself that according to their profession, I'll start judging people how affordable this will be for them.
Sure.
So then I created my father's trust, and every month I started throwing ₹1,00,000 in that. My elder brother was a honest politician. He can't help me with any pennies, but my younger brother helped me a lot. So with that money, what we used to say to these people, please apply when you can't afford to the trust. The trust will give the money. Later on, all my dear friends joined me, and some of my people who came as, patients, they joined me, and that's what I do.
Okay, free cat.
Yeah. All the poor people, we do absolutely free, thanks to my friends and relatives and myself, So with all these, I kept, running the mill and fulfilling my happiness and ambition of serving both alike. So technology was available in my Maxivision. So this slowly got me into looking after people. For me, business is you look after your patient and people who work for you. That's all it is. And my father told me two things. You work hard, you look after everybody who works for you, money will come. Okay?
That's true.
And you deliver truth, money will come. And he used to say, "Ray, keep on giving, it will keep on coming." So I applied all those. And my father was an average person as an individual, but a great politician. But it worked out wonders for me following his teachings.
So when you started Maxivision and over the period of time, you're a great doctor.
Yeah.
But sometimes all doctors don't turn out to be great businessmen, especially
True,
a person like
true,
you,
true,
who believes to give back to the society,
Yeah,
not to make it a money spinning machine.
yeah.
So at a point in time, somewhere you would have realized, look, I need to bring some professional people into the organization who can run this while I concentrate on my domain, which is surgery and eye care and all that kind of stuff. Let somebody run the business. Was that when Mr. Velu and others stepped in, sir?
Yeah, what happened was, I was surrounded by, have you seen the movie Lagan?
Yes, sir.
Okay. And it was against a professional British cricket team against the Lagan team. There are all kinds of people here. Mine was like a Lagan team. I was surrounded by all innocent, illiterate friends. I used to give jobs to my failed friends like me and keep them as in charge. I provided jobs for everybody. And girls, none of my girls were qualified. I trained them and made them nurses. They're still here. My first employee, my secretary Narmada, many companies came forward to take her away. She never left. Okay. I kind of, God was kind enough to give me the strength to command that respect from these people. I never wanted Padma Shris, Padma Bhushans, any awards. My biggest award is my people. They come when I come, they go when I go. Initially I come morning and go in the midnight. So with that spirit I was doing, like I said, but who won the game? It was the Lagan team anyway.
Yes, correct.
So in this country, I won on that day. I was the winner. Not L.V. Prasad, not no other institution, nobody. But then I didn't let that to get to my head. Still I pray Gullapalli Naisra, who is one of the greatest eye surgeons our country produced, and still L.V. Prasad is the greatest institute in the country. With that respect, you see, when you compete, you have to compete with respect for your opponent.
True.
So that you play a better sport. I can't play tennis with a weak player, the ball won't come back. So boring. So I competed with none other than the great man. So with all that, I realized time is, and by then I put 10, 12 centers. I used to visit Vijayawada, Vizag every week and make myself available to everybody. And when people asked me to come to other states, I taught doctors in every state. Doctors came from China one day, 13 eminent doctors. Okay, stayed here for 3 days to learn technology from me. What more can God give me? Yeah. Doctors came from all over the world to learn that technology. And I was invited to every part of the world at their cost. Okay, to listen to my half-an-hour talk. I was invited to Chicago and San Francisco for a day to spend with the most eminent doctors of United States. These are all blessings that are the so-called cosmic force or God. You call your God a different name, I call my God a different name. But ultimately, it's those blessings. That is when I thought, okay, enough is enough. If Maxivision should grow bigger, we need somebody who has a business head. So that's when I met Dr. Velu. And what I liked about, there are many people that I met, because there are different corporates who came to me. One thing I liked about Dr. Velu is he also worked damn hard. He was the son of a librarian and went into IIT, worked so hard, developed his kingdom, looking after his people so well. So it synced with me. So I said, okay, this guy, this is the man I have to be with. So, and then he's so young like my son, I can shout at him. If I go to other corporates, I didn't see any younger person. Velu was very young. So and I always used to, say things, anything he speaks wrong also, I tell him, listen, don't talk like that.
You had the freedom to do it.
And he changed a lot. And I can take that credit, So that is how I associated with Velu, and from then on, this has become a corporate.
So when you look at eye care as a profession and eye care as a business, in the scheme of things in India, usually, it's either cancer or cardiac and then nephrology and other things come. Eye care is somewhere at the bottom, at least in the rural areas.
Yeah.
Okay. Now that government has a lot of schemes to give away free spectacles and all that kind of stuff. There are eye camps which are held throughout the year.
Yeah.
That's been happening for quite some time. But when you look at healthcare as a priority, eye care is somewhere at the bottom. Ival Gakunte, we'll take care of it at a later date kind of thing. It's nothing life-threatening kind of thing. Did you bring in that culture that take care of your eyes because God doesn't provide another one unless there is a donor who matches and, unless your eye can take it.
Yeah.
As much as you did in terms of the laser treatment to remove spectacles, do you see India has a huge population? We're talking 140 crore people. And when that kind of population is there, obviously there are a lot of health issues. And eye care is one of them. As a pioneer in that field, how is it that you have set out a vision to eradicate, say, for blindness in this country?
Sir, of all the questions you asked me, I love this question because this is one thing my heart weeps for. Look at a person like me. Am I available for the poorest of the poor? In reality, no. I'm charging such high price and operating, like I operated on the Prime Minister of Mauritius, Rajshekar Reddy Garu, Chief Minister of this state, and many ministers in the center, MPs, the actors, you name, I did. That eats into my time, no. Where was my time for the poor person? Maybe this much. Very little. So, this lovely question you asked, yes, even today, in spite of all the greatest people this country ever produced in my specialty, okay, Arvind Eye Hospital, okay, Shankar Netralaya. In South, see how it evolved, especially I'm proud of South. Then you go to North, all over India, it mushroomed so much. India is the only country I'm so proud of where doctors still do free cases. There's no such thing as free where I lived in England or in, at least in England we have national health system.
NHS.
The government is taking care of everything. But in US, if you don't have insurance, you're a goner.
Correct.
Okay, their primary health care, I can't say I'm proud of. But my primary health care in this country, I'm so proud of. Every politician contributed. Every doctor contributed. Whatever little. But all that is not big enough. Because today, only about a week ago, I went to a village and we did a camp. And I noticed we picked up 250 cataract patients. In spite of Lions clubs, Rotary clubs, all these great centers like LV Prasad, I said, like Sarojini Devi, we have like government contributing. Why are there 250 people in one small village?
Screening is not working?
Yeah, and then I don't think we are living up to what we are promising. Because it is such a vast and big country, reach is a problem. This particular village where I went, the reach was a major problem. So that was left. Like that, thousands of villages. So population, you said it, you said population is so huge. And there are not enough ophthalmologists. I did for the President of India, the present President, Srimati Draupadi Murmu. I don't know how my name came. One Mr. Subodhji brought my name to her because the first thing she wanted after she became president was she already did schools in her village. she wanted an eye hospital in her village. So Subodh called me. So I said, on one condition I'll meet madam. No awards. I'll silently come, I'll help. So I went, I brought 6 tribal kids here from her village, trained them all to be optometrists and bought equipment and set up a center there. Now we are serving 34 villages there.
Wow.
Okay? And she is so happy. The latest I got, which I'll show you the message in my cell phone, the latest is they wanted to set up an operating theatre because LV Prasad is about 60 miles from that village. So they agreed to do free cases, but for all these people to travel 60 miles is getting difficult. So now the latest request is that. And when I went to that village, because of madam, the village is beautiful. It is one of the cleanest villages I ever saw in my life. Beautifully being maintained. People are so lovely. So ultimately I ended up setting it up. Now I'm going to set up an operating set add-on. So it will be a full-blown eye hospital.
But not everybody is lucky because the president doesn't belong to their village. In this case it was.
This is it. If this is what I always said, if every NRI, which a lot of NRIs are doing that, they are adopting their villages. Okay, still so many other NRIs can do it. It's peanuts for them. Okay, and if they do that, you have heard about many people adopting their villages, laying roads, water facilities, and all kinds of things. If I keep naming, time won't be enough. But
is eradication of blindness, because as I spoke of earlier, it's a very disturbing sign because this is something that can be prevented, something that can be treated.
Yeah.
Unlike many other chronic diseases which we have.
Yes.
But then, as you said, reach is a question.
Mm-hmm.
Not everybody is lucky to have Draupadi Murmu as a president from their village.
Yeah.
NRIs are adopting villages. But do you think there is still a lot to be done?
Yes, because one thing you didn't missed out is people like me are also not available for the poor.
That's true.
Yeah. So if you include that also among all the other things you asked, yes, it is eradication is a big thing. It is still not enough. There was a time I learned in England when I was in neurosurgery. My anesthetist said, Dr. Reddy, why didn't you do this? He said, madam, I did everything. And it, nothing is, satisfies you. He said, Dr. Reddy, you're good, but not good enough. Okay. That is when I learned, there's such a thing called good, but not good enough. That's my problem. I may be good, but not good enough for the poor people in the villages. So that is the problem, not just with me, with everybody. Yes, they are doing great job. How can anybody say our government hospitals, they're doing wonderful. I mean, you go to Sarojini Devi, it will be packed full. Go to LV Prasad, packed full. So, they're all good, but not good enough. We need more of LV Prasads, we need more. And healthy competition is what will get us there at the end.
So at the end of it, when you look at your journey, I know you're not at the end of your journey at all, you're a long way from there.
I am.
But when you look back and say, yes sir? Yes doctor?
I'm 76, so I'm almost there with
No, but still you have a lot to live for now. The question is also that when you look back and say, maybe I should have started my career as an ophthalmologist, I would have gained 10 years of experience, additional experience. I went to general, I went to orthopedics, I did all that. Maybe if I had jumped right at the start into the ophthalmology field, I would have possibly got 10 more years of experience. But anyway, they say hindsight is a very advanced science. Once it is over, people give you a lot of advice, but not before that. But when you look back at your life's journey, I mean, when you say, this is what I want to be known as, what is it that you want to be known as? What should somebody write about you?
A good human, I suppose, because I don't want to be remembered or anything. I don't have such ambitions, sir, because the human memory is very short.
That's true.
People forget people so easily. We forget our own parents. Why go to someone else, We forget all the great people who contributed to this country.
But right behind your picture, right behind where you're sitting, in the picture of a gentleman who's still remembered.
Yeah.
And you're sitting next to him.
Exactly.
So, not everybody becomes a Dr. Kalam or gets remembered as that.
Yeah.
But he was also just an ordinary scientist.
Yes.
Till he became an extraordinary scientist and then became our president. Stroke of luck, you can call it.
Yeah.
But when you look at your life journey, everybody says, even after I'm gone, people should say, oh wow, this gentleman did something.
Yeah. That is what I want to be remembered as, that this gentleman has delivered truth and nothing else in his own field. And if my young doctors can remember me for that, because what I do, what I call is medicine in microns, sir, is my life. Because having done orthopedics, neurosurgery, accident emergency, all these, general surgery, all these things, I realized ophthalmology is different. And especially the specialty of mine, which is lasers, it's all in microns. So if you take away 10 microns excess tissue from your eye, or 10 microns less, I'm not going to get the result. I'll have a very unhappy patient. So when I'm dealing my medicine in microns, it is so difficult, and my concentration levels are 110%. My dedication is the same. So ultimately, when you do something like that, I would like everybody to remember me, as that person who will not, exceed in speaking truth, not even by a micron.
Wonderful. Wonderful. Dr. Kasu Prasad Reddy, I know I'm holding you back from attending to your patients right now.
No, sir. No.
Possibly 10 patients would have been seen by you in this half an hour conversation that we had. Precious time, I won't take it away. But it is wonderful speaking to you.
Thank you.
And understanding so much about a field which people rarely speak about. It's not as, I wouldn't call it romantic, but not as high profile as the cardiac or something else that is there. But it's wonderful speaking to you, learning about you, how you started, where you are and where you want to go. Thank you very much, sir.
Thank you very much.
Thank you. Ladies and gentlemen, that was Kasu Prasad Reddy. Hailing from a political family but deciding to strike out on his own. Went abroad, changed the fields of specialty and finally ended up what he loves doing most. Not everybody is as lucky as that. Most of us at the end of our life say, I could have done that. But I guess he's living a life where he's doing what he wants to do. And that is important. Thank you for watching. Jai Hind.